Hi everybody, my name is Kimberley Wilson. I'm a Chartered Psychologist with my own practice here in central London, and I want to talk to you today about anxiety, what it is, how it affects us, and what we can do to manage it. Anxiety is a universal emotion, which means it affects all of us, and it's hardwired into our brains. And the reason for that is that it serves a survival function for us, protecting us from potential dangers in our lives. Anxiety is associated with a lot of physical changes. So there's an increase in heart rate, an increase in your breathing rate. You'll also get a rise in your stress hormones, and that will trigger a release of sugars and fats into your bloodstream to help your muscles have enough energy to fight or flee. And that's why we call it the fight or flight response. And it's not just psychological. Anxiety affects us on all levels. So our mental health, our physiology, and also our behavior. Psychologically, anxiety is associated with an increased level of alertness, in particular to negative things in the environment. So you're paying much more attention to potential threats and problems that might be coming your way. That increased vigilance for threat is associated with an area of the brain called the amygdala, which is our threat detection center. And what we know, for example, is that people who have a diagnosis of generalized anxiety disorder have a larger amygdala than people who don't have that diagnosis. And behaviorally, anxiety is associated with what's called behavioral inhibition. And that basically means that when you feel anxious or nervous or worried about something, you can't think about anything else and you can't do anything else. All of your attention is focused on the thing that's causing you all of that worry. Now, if you think you suffer severely from anxiety, then it's probably best to seek the support of a mental health professional. But like I said, we all experience anxiety, and there are some things that you can do that will help reduce either your risk of becoming anxious or the severity of the anxiety that you experience. One of the most protective things you can do to help prevent anxiety is physical exercise. And what we know is that physical exercise actually strengthens the body. It kind of builds resilience into the entire physical system, so that when you do experience psychological stresses, your body and your mind is much more robust and able to manage it. There's also pretty good evidence showing that a healthier diet is associated with a reduced risk of anxiety. And when I say a healthier diet, it's all the stuff that you've already heard about. So plenty of fiber in the form of whole grains, beans, peas, and lentils, plenty of fruit and vegetables, oily fish and omega-3 fatty acids, and some fermented foods and prebiotic foods to feed the gut microbiome. On the flip side, diets high in sugar-sweetened beverages and saturated fats tend to be associated with a higher risk of anxiety. So I'm not saying you have to eliminate them altogether, but the evidence suggests that if you can keep these foods down to maybe around 3 times a week and make sure you're getting all of those other nutritious foods in, then you're going to create the physical conditions that will help you to experience less anxiety. And the other big thing is sleep. What we know is that if you're not getting enough sleep, the front part of your brain, the prefrontal cortex, which is in charge of your decision making and your impulse control, stops talking to the emotional center. And that basically means that that threat detection center, that amygdala, is in total control, and you're not getting those messages from the front part of your brain saying, things are fine, it's cool, you can handle it. So making sure that you're prioritizing getting good sleep will help to keep the communication between the PFC and the amygdala strong and correct. And there's also some emerging evidence that mindfulness practices like yoga or meditation can reshape the brain in a way that's associated with less anxiety. So if you do suffer from anxiety, it might be helpful to try a few yoga classes or Tai Chi or some sort of mindful movement to see whether it helps your symptoms.